This is a human heart. It's roughly the size of my fist. This is also a human heart. You can see it's much larger. This is also a human heart. You can see that this heart is much, much larger. A couple of things we can see on this heart is this bypass. As a matter of fact, we can see some staples left in this heart from the bypass. This vein came from the great saphenous vein that's actually found in the leg. I'd like to point out the size of this aorta, it's literally larger than my thumb, and we can still see the plaque that's actually being deposited on the edges. We can see some repair inside the aorta from the aortic aneurysm. We can still see some of the stitches that actually are left there. But the thing that I really wanted to show you is when we look inside the ventricles, we can see the structures that are actually called the trabeculae carneae. And this is the papillary muscle followed by this chordae tendineae. So these chordae tendineae are actually the heartstrings that people refer to. So when people are telling you not to pull on their heartstrings, these are the heartstrings that they're talking about. These are actually connected to your valves, and they keep your valves from prolapsing. But it's kind of neat to see the inside of the heart. It's not as smooth as most people would imagine it. Thank you for your time. One more thing quick. This is an abdominal aorta, and we can see the areas where the superior and inferior mesenteric arteries that will provide blood to your intestines would come from. If we flip it around, we can see that there's been some repair done to the aorta as it had an aneurysm. And we can still see the remnants of this Dacron tape and this stitching that's actually inside there, which is really neat. So somebody was literally stitching inside of this aorta. And this reinforces the wall. One of the things we can also see is the incredible plaque deposit. That should not sound like that, and it's present all over the aorta, and you can see it even goes into the smaller blood vessels as well. It's very tough. So eat healthy if you want your aorta to be nice and smooth. Also, you can appreciate the size of it. It's literally like a garden hose. And you can really appreciate that if this aneurysm would burst, how fast it would bleed out. So, thank you for your time.